Welcome to Work Better, a podcast where we think about work and ways to make it better. Dr. Upali Nanda, welcome to Work Better today. You've been doing a project in Atlanta, right? That's with the Center for Brain Health. And you've created a living lab. I'm dying to hear about this because I think it's this concept of training people to work differently isn't something that I ever thought about before. So I was wondering if you could just tell us a little bit, maybe for starters, before we get into this, let's get some basics. Like the affordance word was really helpful. And when you talk about things like neuroplasticity, et cetera, maybe if you could just talk about what you think brain health is and what you started learning in this Center for Brain Health in that experiment.
Thank you for asking that question, Chris. The WHO definition of brain health is a state of brain functioning across cognitive, sensory, socio-emotional, behavioral, and motor domains. And the intent is that brain health allows a person to realize their full potential over their life. Right? This concept of full potential is very, very key to what we're talking about here. In some ways, to me at least, I translate the amount of emphasis we have in society towards physical health is to keep us, or physical fitness is to keep us from having disease, right? Physical diseases. The concept of brain health gets us to cognitive fitness that can also stave off things like mental health disorders, dementia, chronic stress, acute stress, depression. But we're not preventive about mental health the same way that we are preventive about physical health. We don't have the vocabulary, we don't have the tools. And our journey on the brain healthy workplace started from there. We were always interested in this intersection between neuroscience and architecture. We did work on neurogenesis, for example, like how enriched environments can generate new connections in the brain for older adults. We looked at socio-emotional learning in educational environments. But when it came to the workplace, we really started engaging deeply in this concept of brain health during COVID.
Okay.
We dug deep into it because we were really trying to, in theory, we had this ultra convenience suddenly of complete hybrid work. In theory, we should have been taking more walks, been getting more rest, been giving all of that time that we gained back to work, back to the things in life that we felt we were missing. And yet we kept seeing this increased challenge of mental health. We started seeing more people asking for mental health leaves of absence, more mental health sabbaticals. So we knew something was going on. And so we partnered with the Center for Brain Health. And it was very intentional to say, it doesn't feel like we're fixing the problem if you're putting Band-Aid on something after a mental health issue has happened. We really need to be proactive about it. And the approach of the center was the brain, just like your body, needs fitness. It can be trained. It can be empowered to do its maximum potential work. And so we embarked on this pilot project for the Brain Healthy Workplace, where we did three things. One, 200 employees took the brain health training. They really took training on how to build strategic attention, how to build integrated reasoning, how to build innovation and thinking. And there were these 9 strategies that the center has that we trained this cohort in, that they trained the cohort in.
Can I ask you to pause just a second, because I think this is so important that I want to go back and make sure that we're all tracking with you. So, I mean, most of us have never thought about training our brains in the sense that you're talking about. We think about, as you said, like training for a marathon or training for a physical event. And we certainly think about learning But can you talk about the difference between, like just the learning that we would normally do as part of our work or our education and this notion of training the brain? I just think that's really fascinating.
Absolutely. And I would really defer to my colleagues in the Center for Brain Health for more
Hmm.
in depth insight on it. But the distinction was that you're not just doing it for learning. In fact, learning is a way of training the brain to be more fit.
Hmm.
Learning is one of the things that actually keeps our brain healthy. So,
Right.
what they did through the different strategies that they have, they helped us with little training modules on how do you build strategic attention? Like, how do you improve?
Strategic attention.
Mhm.
What is that?
Improving focus
Okay.
and prioritizing important information.
Okay.
So,
Which
there
we're
were,
probably really bad at
oh my
as
God,
a
so
society.
much, so much, Chris. I mean,
Yeah.
I'll share with you like one of the things we realized in terms of our current state was the amount of multitasking we do,
Right.
and we think it makes us do more in less
Right.
time. In fact, it makes us do less in more time.
We'll release episodes weekly each season. You can find us on your favorite podcast platform, including Apple Podcasts and Spotify. Just search for Work Better. And make sure to subscribe to get new episodes as soon as they're released.